I'm here with Bykoski, Program Manager at Sustainable Pittsburgh. Thank you so much for joining us today.
Thank you, Liaga. Thanks for having me.
So today we're going to talk about the Allegheny Eats program. Can you just give a brief description of what the program is and what you guys provide?
Yeah, so at Allegheny Eats, it's a one-stop shop where consumers are able to support their favorite restaurants while helping to feed industry workers and providing some security for local farms and producers through the purchase of meal kits for at-home dining.
And
sorry, go ahead.
No, keep going. Go ahead.
I was just going to say, so for consumers, when a consumer purchases a meal kit through Allegheny Eats, a portion of those proceeds come back and work directly to the project to help provide meals for local food service industry workers who've been impacted by COVID-19.
And how did this program come about? What made you guys create this program?
So yes, there was a group of partners, including Sustainable Pittsburgh, Craft at Chatham University, Black Radish Kitchen, who was our inaugural restaurant that we worked with, Pittsburgh Food Policy Council, PASA Sustainable Agriculture, 412 Food Rescue. There's a slew of us that came together and were recognizing where there were these breaks that were exposed in the food chain due to the COVID-19 pandemic. When we look at restaurants, they've suffered some major losses of revenues. Restaurant workers, a lot of them are out of work. The unemployment rates are down something like 21% since the rate they were last year. As well as, needing a stream for produce and locally produced goods and dairy and meats to be able to continue to find ways into these restaurants and continue to help to fix these breakages. So with that, we applied for a grant through the Richard King Mellon Foundation, and we were awarded that grant to start this project. It was intended to be a one-year project, but we've had so much engagement and positivity around the project thus far, and donations that are coming in to be received that are really enabling to help us grow. And as I mentioned before, each meal kit purchase does also feed into the program too. So we've got a lot of ways in which we're building revenues to be able to grow it and expand it from what we ever intended, which is pretty awesome.
So you mentioned that when you get a meal kit, part of the proceeds go into the program. So when somebody gets a meal kit, what is included in that? And then talk more about how it kind of goes back and helps people involved in the industry.
So yeah, with the meal kits, all the meal kits are designed to feed two people. There are many different options from both the Vandal is one, Bebe's Kitchen, Black Radish Kitchen, and Casa Brazil. So we have a variety of cuisines that are represented, a variety of and diversity and ownership that's also represented. So that's really cool. But yes, with each meal kit purchase that is designed to feed two, you purchase the meal kit and they come to you almost not like a HelloFresh, but similar to.
Mm-hmm.
Say they're a bit more prepared than what HelloFresh is, but you pick them up at the restaurant. In the case of Black Radish, they deliver their meal kits. And then you get all this delicious food and you do just a little bit of prep, and then you're enjoying this wonderful meal from one of the 4 participating restaurants. And then with that purchase, there is the add-on donation that comes back to the project that enables us to feed more workers.
You mentioned a couple of the restaurants that are involved in the program. These are just the inaugural ones. Are there plans to expand the restaurants or kind of switch them out every once in a while?
The restaurants, the 4 that we have are our inaugural 4, but we are looking to grow that, which is great. And the more people that we have buying meal kits and the more donations that come through the program, the more restaurants we're going to be able to bring in to help sustain them throughout this pandemic until there's a little bit more certainty for them in the future.
It's good to hear that there's so much enthusiasm around the project. I know this program just started, I think maybe 2 weeks ago. How has the process been so far after your initial launch?
I'm sorry, how is the what?
How's the process been going so far after your first couple weeks?
It's been going well. It's been going really well. Yeah, we officially launched the project on January 11th. So far, so good. Going really well. We've had, a couple mild hiccups, and some things that we have recognized that we need to maybe tweak as far as messaging goes, but all in all, it's been going really smooth. I mean, we took quite some time. We started working on this project over the summer, so it's been quite some time that we put into it. And so we were really thoughtful about our approach and how we could be most impactful. And I think that it was worth taking all that time, but it's been, I'm taken aback by the amount of donations we've had coming through, the amount of purchases we've had on the site, and just feedback from industry workers that are receiving these meals and how much it's really helping them right now. And as far as restaurants, I mean, they're thrilled with it. They're very excited too. So we've made some new connections with some new farmers for some of the restaurants. So it's been really great. We're really kind of hitting every mark we were trying to, which is fantastic.
So finally, let's say somebody wants to get a meal after this. How can people get their meal kits or find more information about this project?
So you go to AlleghenyEats.org, and from there you can learn all about the project. You can check out the meal kits that are available for purchase. You can make purchases there. I will say that it's Allegheny Eats, so this is kind of more of a Pittsburgh region-based program. But we're also looking into gifting options too. So that might be something, another way, if you're not in Pittsburgh, but you have family in Pittsburgh, that you might be able to gift a meal in the future.
Okay, awesome. Rebecca Bykoski, Program Manager for Sustainable Pittsburgh. Thank you so much for your time.
Thank you so much, Liaga.
Join our guests for insights on issues impacting local government and the citizens of Pennsylvania. Created by the Pennsylvania State Association of Boroughs, Inside Pennsylvania Boroughs connects you to legislation and policy that will affect you and your family. Your host, Chris Kapp, and his guests discuss current affairs that matter to you most. Connect with your state by tuning into Inside Pennsylvania Boroughs on Sundays here on PCN.
I'm here with Senator Katie Muth, Democrat representing parts of Berks, Chester, and Montgomery County. Thank you so much for being with us today.
Thanks for taking the time to chat with me. I appreciate it.
So to start off, despite the vaccine being introduced recently, several counties in Pennsylvania have experienced high numbers of COVID-19. Do you know the trend of COVID-19 in your district at the moment?
Yes. So my 3 counties, they've been pretty much steady in the areas related to the numbers. We were the hardest hit counties initially, had a pretty decent summer lull, and then spiked back up. So I think each of my counties have been above 200 for at least the last month. New cases a day, I should say.
And we're currently in phase 1A of the vaccine rollout plan. Based on what you've heard or observed from people in your district, how do you think that process is moving along?
Not well. I think that there's a lot of frustration. I know that, 2 of my counties specifically have the infrastructure to, distribute this vaccine in a more mass quantity. There are not enough of vaccines. I believe my last conversation with Chester County was they only had around 2,500 vaccines given to them the last week. And so 500,000 some people in a county, you do the math. And so I know that we're certainly frustrated with the supply not meeting the demand. And I think knowing that we have to be more honest about expectations. And I think because people have just been rightfully so, right, sitting at home, anxious for how many months now about a multitude of things. And then here's this vaccine and it's supposed to be rolled out. And instead of saying, hey, everybody sign up, it's not like an Amazon order that's going to be there in 2 days, that you may sign up and it may take several months. And just being a little more forthright with that communication instead of, just saying this is, you wait for your call. People just need to know what's going on. And I, to their credit, as frustrated people are, my team and my district office have fielded calls and people who can't sign up online and those logistical things, and they're very gracious for information. So I think all levels of government just have to do better at communicating and being honest about what we're dealing with and really working together collaboratively, not for the sake of corporate gain, but for human good, and figure out how to roll this out.
What are some ways that the process could maybe be more efficient? Do you think it's mostly a supply issue, or what are some of the problems that are happening at the moment?
So from what I've heard from constituents and also just even, professionals in some of the field. So for example, I'm not clear on why the federal government partnered with pharmacies the way that they did, in the sense I assume pharmacies would be just given those vaccines on site like they do flu shots, which makes sense to me, but they are also going into long-term care facilities and where they have infection control nurses. So I know some state homes have already vaccinated people that are in the, the long-term care facilities, whereas, other entities have to rely on one of these pharmacies to come in to implement the vaccine. I just actually got a text earlier today from a pharmacist, not in my district, but out near Johnstown, saying that she's very frustrated because they're now running behind the counter, filling things. Someone comes in for an appointment that it's just stretched them really thin. And then this isn't safe. And she wanted information, for the State Board of Pharmacy to just express her concerns, right? To not have feedback from the people that are doing it makes the recipe for disaster, right? So I think the sign up situation needs to be standardized across the state. I know that people are signing up in multiple counties, hoping they get a call, which I understand, right? There's no judgment there. People are scrambling, especially people that work on the front lines. And so, their availability may change. I wish we were doing it by, maybe by grocery store, like how do we get this giant vaccinated today? Or how do we get, this, like I think this can all be strategized and organized. I think there's just not a plan that seems to show what we're getting coming into the state. Where is it all going? And that's frustrating, right? And I can't answer those questions. And we've been asking, the administration for more clarity and transparency, even just on their own tracking.
I know you serve on the board for the Center for Rural Pennsylvania. I also know that only a small portion of your district is actually rural, but are there certain issues as it pertains to COVID-19 and the vaccine or otherwise that affect specifically rural communities that you want to be addressed? I think,
what information, maybe not necessarily so much in my district, because as you mentioned, it butts right up against suburbs, but that are they, especially because my county that's rural, the part of Chester County, they have a health department, a county health department. So I think that's a distinguishing factor. And there are, that's not the case in these rural counties. So for example, I was actually in Susquehanna County this weekend and, I saw some pharmacies around. I didn't see any signage about vaccines. That's not to say they're not doing it. I know they're receiving vaccines, but what is the outreach like? What are the methods of communication? Internet and broadband up there in these rural counties is spotty, right? So can you even sign up online? Do you have the capacity to check in for new appointments opening up? And also, do people understand it? Are they afraid of it? Like my parents, my stepmom and my dad live in Westmoreland County, and not really rural, but it's kind of in the sticks. And, and my stepmom works at a hospital and she's like, is the risk worth it? Like not knowing what we don't know about all these things with the vaccine. And I'm like, yeah, you have pre-existing conditions. That's my advice, but you have to make an informed decision. And do you have the right information? Where are they getting the information? So I think that's definitely a limitation for these rural counties, and not having that county health department as an entity to reach all of its different areas.
And finally, it's a new year, a new legislative session. Of course, COVID-19 is a big priority for everyone, but what other issues are you looking forward to addressing in this new session?
Pretty much anything that helps humans, certainly with a public health focus beyond COVID. So certainly with clean air and water, specifically water. There's a lot of water contamination issues in Pennsylvania that causes health problems that can make you into these categories that allow you for early vaccination because you have these health conditions or problems, and increasing transparency. Right? Like we need this, the state government needs to be more transparent and it's in every capacity. And that's certainly not the favored trend in this building. But some may say that they are for it, but if you can't find out information as a member of the general public, that's problematic. And so if you don't know, how many, toxic waste injection well sites permits are in your county? Do you know that it's even, just kind of these basic common sense things are, me and my team are really trying to, kind of have a public awareness campaign of these are the things that could exist. And maybe you thought they existed to protect you and your family in Pennsylvania, but they don't. and then also the economy, right? Like where's Pennsylvania go from here? Is post-COVID, whenever that is, there's going to be industries that are decimated. There's going to be some that have grown. There's going to be people still out of work. And what are the opportunities available to them to be financially secure and sustainable? So those are all things that me and my team are very focused on right now.
Senator Katie Muth, Democrat representing parts of Berks, Chester, and Montgomery counties. Thank you so much for your time.
Thank you. Have a good day.